Gibson.
Would you bow your heads with me? Our God, Father, we thank you for this day. Thank you for the opportunity and privilege of which you give for us to meet. We ask your blessings on all that will be done in this meeting, that it will all be done for the betterment of the citizens of our community. And we pray, amen.
If you have any cell phones that are not on silent, could you please silence them so they don't interrupt the meeting? Thank you. The agenda is before you. Are there any changes or additions to the agenda? If not, we need a motion to adopt the agenda.
So moved.
Okay, we have a motion and second. All in favor say aye. Like sign. The motion is carried. The minutes were distributed in your packet, but we have two corrections. On the absentee list, we forgot to add Diane Bean, so we're gonna add that. And head and approval of the June 20th, 23 minutes, that should say April 17th. 2023. With the minutes being corrected and additions added, do we have a motion? We have a second correction. Okay.
A second.
All in favor say aye. Like sign. The motion is carried. We didn't have anyone sign up for the public forum, but if there's anyone here that wanna. All right, so we'll move on to the administrative reports. First, we'll have the fiscal update and fee schedule by our own Tim Martin.
Good evening. I apologize for sounding like a frog. So, before update for Scotland County as of July 31st, 2023. First thing we will go over will be the FY23 budget. Although the budget is over for 23, things that were purchased in last year's budget, we're still getting invoices for, and anything that we receive revenue for also can go back into next year's, to last year's budget. So as of right now, you will see that we are, 88.8 under budget for the year of FY23. Anyone have any questions on any of that information? I will say that since the county has changed some things now, starting next month, you should be getting this financial report in your board packet. They've changed some systems and Munis and updated some things, so you should be getting in your packet, so you won't be seeing it for the first time when you get here next meeting. Any questions? Okay, and the next one will be revenue collections. Excuse me. We are at 83.7% collected for the year. Once again, we do have up until August 31st to put back any revenues that we earn this into the past fiscal year. Any questions on any of that?
I'm not following you. What page are you
On the fourth page. It's not on the screen. It's the one that says Scotland County Health Department Revenue Collections. I'm sorry, it's front and back on y'all's pages of front and back. I apologize.
I'm not sure.
Yeah, that one.
Okay, thank you.
Any questions? Okay, on the next couple of slides, we will go over what the budget actually is for FY '24. At our last meeting, it was in a draft form. So the slide that says Collin County Health Department operating budget, as you can see, 22 and 23 compared to 23, 24, and the difference in the last column of the two budgets. Y'all have any questions? Y'all found it?
Like a pretty big jump in the administration.
The jump in administration, part of that is because of the infamous salary study. So the salaries have gone up this year from what they were last year. I shouldn't say infamous salary study, but the salary study being done caused numbers to rise. Any questions? Okay, on the next page will be the revenue collections. Excuse me, the revenue budget for this coming year versus last year. As you can see, we are a little bit less of revenue this year than what we did last year. I would like to point out that there are two programs that we no longer have. Infant mortality reduction ended. However, we did apply for a grant to get that money coming back in, but right now it's not here. And also
What grant did you say, Tim? I'm sorry.
the infant mortality reduction grant.
Uh-huh.
That was a grant that was given, the state sent out to I think the bottom 20 of infant mortality rate. However, now they changed it where you have to apply for it through a RFA and through the whole grant process, and which we did.
And they've rolled it out 3 times already. I'm still waiting to hear if they're gonna accept it or.
And the other was the Advance in Health Equity Grant, which came along with the COVID information, COVID grants. Any questions? Okay. The next thing we want to discuss, or I want to present to you, is some information that you requested from the last board meeting. Can y'all hear me? Well. So the very first piece of paper you have will look like this. It is actually the policy, the setting fees policy that the health department has in place. So this is the policy that was created to show us how we create fees for the health department. Everything in the health department is not free. We do have the ability, according to general statutes, can't say that word, general statutes, to charge fees for services to offset costs for the health department. So in this policy, you'll see the procedures for what we do, the clinical service fees, and I'll go into more detail in just a moment. This is an accreditation requirement, 33.5, that we do this. Private vaccination fees, we'll talk about in just a moment as well. Laboratory fees, lab to go fees, even environmental health fees and animal control fees. So basically what happens is the next piece of paper you will see will look like this. What it has on it is, this is the clinic name. This is called a workbook for setting fees. basically what this does is we have to, when we provide any service in the health department, clinical service in the health department, we have to fill out this form. And if you look at this form in detail, it goes down all the way to how much paper you use, how many tissues you used, how many Band-Aids you used, how much paper you used to cover the table. So all this stuff has to be calculated before we can come up with a cost for the fees that we serve. The majority of the costs will come in on the second page where you see the human resources part, which is actual time for the nurse and the provider and registration and billing. So if we go through this really quickly, we'll find out, this is the flu shot from last year. We'll see that on line 20 at the bottom on the first page, you'll see the Fluorix, which is a pre-filled syringe. There's one of those that costs $19. The actual flu vaccine itself costs $19. On the second page, you'll see the time spent for human resources for the nurse to give the shot, registration, and for actually billing. Then on the last page, you will see where they use the Band-Aid, alcohol pad, and gauze pad. So for a total cost of that visit, according to this worksheet, is $40. So our fee was set at 42 because we went times 5%, and then we rounded up to $42. So that's how we come up with the cost of the actual flu shot. And this is actually done for every fee that we set in the agency. Any question? Okay. The very last paper you have, the very last thing you have is this. It says FY24 fee schedule. This is the one where you asked for a little more information on as far as how as the differences. On this paper, you will see in the very first column, third column, FY23, and then FY24. In the last column, you will see the changes that were made in between the years. So you'll see the first page, there is no change. The second page, there was changes in the immunizations that we were given. And then the only other changes that were made were some of the labs to go fees that we charge. Any questions on how we set fees or how we go about doing that? I will put a little heads up in your ear. We have not changed environmental health fees since 2007, I believe, or 2000. It's been a long time. So that's something we're going to look at possibly changing in the future. And if there's anything else you guys won't have questions about, I'll be happy to answer.
What does environmental health fees include?
That would be your inspections for your well and septic tank permits, new and existing systems. You have to help me out.
TFB permits, plan review, application. So anything that's environmental health covers.
And that is actually handled at our inspections office at Morgan Center. So those fees are collected there. Any questions?
Thank you, because we was, it's real detailed, because I know we was asking, it was confusing.
I was hoping to give you as much detail as I could, all the way down to the Band-Aids and to the everything that we have to do. This is a requirement for accreditation. So let you know that we don't just set a fee just saying. A lot of companies and a lot of departments and primary care facilities will set their fee based on Medicaid. We are not allowed to do that. Medicaid can be reimbursement can be used, but we have to actually have backup with that document that I just showed you that shows that we've actually considered the costs, the complete cost of the visit. So. Thank you so much for your time.
Thank you. Good job. Next up, we have our monthly activity summaries.
Okay, so Sharon has the July, graph up on the different services. If anybody has any questions on those? Sharon, the advance it. In the thing. So, I send out the health director's report every month, but I just wanted to highlight a few things. We participated in the National HIV testing date on June 27th. Testing was provided at the health department and at Walmart Pharmacy. We had approximately 35 individuals tested, and we received a $5,000 donation from Walmart towards the PrEP clinic. Donna had spoke last time about the need for PrEP, so we received $5,000 grant from Walmart for that. I met with Laurinburg Police Chief Mitch Johnson to discuss animal control and collaborating on gun safety. And we discussed rabies control and the procedures that the city needed to use as far as dog bites. I've been here a year and have not received any reports from the city on any dog bites. And I know if we've had 4 or 5 in the county, they've had to have had some in the city. So he's like me, he was new, so he didn't know the procedure. So we met and went over that. I've attended health directors training in Raleigh. It is a 6-month course in Raleigh in person. That's why we needed to move the meeting from tomorrow till today. I'll be leaving tomorrow to go back for the August meeting. We were closed July 24th for staff development training, which consisted of HIPAA and safety training for our staff. I attended a opioid settlement training with the county manager, Jason Robinson, and April Sneed, and the county finance officer to discuss program options for the opioid settlement funds. We got some good information from the state that day. There's 2 options, option A and option B. Some of the things in option A, we are already doing in the county. It's just we haven't, set that as our program, like the reentry program is one of the things that was listed on option A. So there's going to be more meetings on that with the county manager and board of commissioners to discuss the opioid settlement funds. The state's going to come down and provide like a town hall meeting so people can ask questions. I've met with our senior management team to discuss new programs and options to improve the current services that we have, and they came up with some great ideas. We're still working on the Diabetes Smart program to get accredited for that. I wrote a grant for, it's a federal grant for Vaccine Equity Project, and we were approved for $75,000 for that. And what that grant consists of is to campaign and promote flu and COVID vaccinations to our minority populations in the underserved areas of Scotland County. So my plan is to have some clinics, some community outreach. Donna, we're talking about the mobile unit. It doesn't look like we're going to have it this fall. They've pushed the date back to this winter before we'll actually have it here. But setting up some community clinics out in the community rather than just at the health department to try to pull in some people that have been hesitant about getting the vaccine. I requested $27,191 from regional ARPA funds. Cumberland County actually holds the budget for the region, but we have to come up with ideas and things to spend the money on. And one thing was equipment. So I submitted a request for $27,191 for animal control, environmental health, and clinical programs. So that will be some cages for my animal control, some on-site equipment that they need for environmental health. And we went ahead, Donna, got some quotes on some items that we're gonna need on the mobile unit once it does get here. Urinalysis machine and a couple other things, so, that's been approved. So we're in the process of, getting that funded in. Renovations are gonna be beginning soon. It was supposed to start today, but I don't think anybody showed up, did they?
The contractors were on vacation last week, so tomorrow or Wednesday.
Renovations will be starting on our general clinic room, and it's being funded through COVID funds. Mobile unit, as I said, they pushed the date back for completion to winter of 2023. We have purchased our minivan that was approved through COVID funding. We got it in, I think it was the end of last week. And we actually put it to use this weekend for the back to school event. So we were excited to have it. We've updated some policies, the performance evaluation policy, the use of county property policy, rabies control plan, diversity and retention plan, medical records management. We've had some personnel updates. We have hired 2 processing assistants for management support. One is starting the 16th this week, and one will start on the 1st. And we had a processing assistant 5 that started, how long has Angelina been here? A little over 2 weeks. So hopefully we'll have Ms. Deb's department fully staffed. We're still recruiting for a nutritionist 2 and a CD nurse and a part-time HIV case manager. The public health nurse 1 position, the lady had resigned, but she decided to stay. So she took back her resignation so that she'll stay with us. My goals for next quarter is to work on filling the staff vacancies, continue working on the Diabetes Smart accreditation, work with Donna on rolling out the PrEP clinic, and rollout of the vaccine equity project, and the completion of the renovations to the clinic area. Does anybody have any questions?
All right. The next item of business is unfinished business, but that was Tim's area that he went over the fee breakdown. So that was the only unfinished business that we had. So he did that. The next item of business is new business. So we have the departmental focus. Shakila, did I pronounce your name? Shakila. I knew I was gonna.
It's okay.
Shakila.
So this is Shakila Colden. She's our new WIC director for those who haven't met her yet.
Hello, everyone.
Yeah.
Yeah, so I've worked for WIC a little over 5 years. I was at Cumberland County first. I'm actually a nutritionist, but now I'm the WIC director, so I'm here now. And so I just manage the program and just try and keep it in order. There are some renovations that are going on, some restructuring in the office. So looking forward to that. And that's pretty much it.
Thank you for coming, because I know we've been looking for one for a
Oh,
long time.
yeah.
It was a long time.
We're excited to have her.
Yes.
Madam Chair, I'm sorry. to
Yes,
speak out of turn. Would you like to continue with the department updates?
Oh, it was not finished. You didn't finish.
My part's finished, but I
I'm
think there was some
sorry.
clinical updates that went out to y'all in
Okay,
the
I thought it
packet.
was, okay. Move back to that departmental reports.
For clinical, I'll just say that we are trying to.
Miss Donna, can you come up to this podium?
We love to
used
see,
to be
we
in
love to
other
see
buildings.
you. I know.
I don't have a whole lot to say, but we are in an effort to try to build the public health workforce, especially nursing. We do continue to host Richmond Community College students and St. Andrews comes, and we are also, we precept our PA precepts from Methodist PA students. So we are trying to build our workforce a little bit. as some of us get older and phase out. Sharon, go to we participated in the Scotland Health Fair. I just wanted y'all to see the pretty pictures of all our beautiful faces that attended the health fair at the hospital this year, the pregnancy fair. So we're trying to get out there, and but otherwise, I don't have anything else to say. You guys, you have any questions? I'm here, but otherwise, you have it in your packet so you can look at it.
Is that a machine still at the front, the testicle machine?
Did they move it yet?
No,
Because I was
the COVID,
Moving
I
it.
wished it was because now COVID numbers are going
because I was
up.
referring people to that, and then when I passed by, I didn't see it. I said I was gonna
They
ask.
came, I think it was last week
Really?
or week before last, and picked it up because COVID funding ended. And it was gonna cost $7,000 a month to keep it.
Oh,
Yep.
Yeah. I'm
That's sad.
sad about it.
We did give out a lot of those.
Kind of compliments you have out with
Yeah.
that one.
Saturday.
And we
Oh,
still,
yeah.
yeah, we still have the home
Oh,
kits.
no.
If people wanna come by and pick up a kit.
Ms. Diva, what did we spend on that? Did we,
When we got it, we didn't have to pay anything. It was through the state COVID funds. But once that ended, the public health emergency ended in May, and there was no more funding. They gave health departments the option of paying $7,000 a month to keep it. And I had talked with the county manager at the time, Mr. Patterson, and we just didn't have the funding for that.
wow. I was referring people to it. Yeah. Okay. Any management support updates? Who's doing that?
Question. Ms. Deb, is that yours?
Miss Deb.
Ms. Deb.
Miss Deb.
Ms. Deb.
Yeah, I was looking at it. That's a.
Yes.
that's an old one.
What happened to money?
Yeah, that's old.
Okay,
That's got Eddie on
They
it.
closed it down when?
okay.
Yeah.
We can move on past that one. That's, now we're back on track.
Yeah.
All right. So we were back on new business and we did the Department of Focus. That the funding that you went over, you discussed it. Is that something we need to approve?
Yeah, I think y'all have to approve any
Approve
new
in that,
funding.
in that new. All right. So this funding that was discussed, by Amanda in her update, that's $220,053. The $75,000, the 5,000 Walmart grant, we already know about that. And the $27,191. We need a motion
And the
and a
17.
second, in the 17th.
So moved.
The 17.
You got an
17.
old one.
I got an old.
The old one.
See,
This
I
is
got
the
a-
revised one.
Okay. Yeah. And the 17,525 ICO for MCH funds for breastfeeding. So we need a motion and a second to accept this new funding.
So moved.
Okay. We have a second. Second. We have a motion and a second. All in favor say aye. Any opposed, like sign? The motion is carried to accept this funding. All right. So now we have, making sure I got it right.
Everything else
They're the
is the
same
same.
thing. Okay, the funding rolled over from last fiscal year, which is the $90,676,000 and the $183,952 from the vaccination program. So we need a motion and a second for those two. We have a motion for those second two? You have a second? Okay, we have a motion and second. All in favor say aye. Any opposed, give light sign. The motion is carried to accept the funding rolled over from last year. Okay, next item of business is informal discussion. I only have one thing. It was about the plastic book bags. Have y'all heard about, Richmond County and some surrounding counties are not, they're not requiring the plastic book bags for the kids anymore because the plastic it carries a cancer risk. So
It
Richmond
carries
County.
what?
A cancer, they said a cancer risk. So, Richmond County, they had purchased a lot of those, and then they pulled it back under their health department's recommendation. I don't know if y'all heard about that. So, Dr. Hatcher, she was gonna look into it more to see about next school year or see what that's about, because none of the surrounding, it's all the same reason about the plastic. So that's something maybe we can look into.
I don't know what you said.
The plastic and the clear book bags that
Make me
they're
know how to
requiring the
get a hearing
kids to take to school.
The plastic,
The plastic.
So you learn how to talk
Yeah.
and stick to it.
You know, sometimes it carries cancer risk, and the material that's put in it, that's made from. So we require them for our school district, but other counties around us recalled and they went back to regular book bags. But they followed their recommendations from the health department.
the regular, what is it that's made out of plastic?
The book bags.
The book bag, oh, the book bag.
Clear
The
plastic.
clear, with, yeah, the clear plastic. Yeah.
So my,
So,
my initial question would be,
Yeah.
what, like accredited, like peer reviewed
right,
data did
So-
they use for that?
because that's all I was
So
like,
that's what I would ask, that if someone is requesting that, they could present that to us, because I presently am unaware
yeah,
of
because I haven't heard
any,
anything.
of my like, any of my like, the AAP coming out with any
Right.
position statements about clear book bags at the present. So if there is, that would be also welcome, so that I could present it to our North Carolina Medical Society, that is what governs most of our childcare here.
Mhm.
So if they could provide that, we can look at it and definitely see.
Did you see? Because I was gonna ask Richmond County, because I was like, so the health department recommended it.
I hadn't
So
heard anything
the
about it.
first time I heard Dr. Pedro, she called and asked me last night, and I haven't heard anything. That was the first I've heard. So I said I was gonna mention it because like this school year it'll be too late because we already distributed all those book bags. We already put out our requirements. But if it's something maybe next school year, because it'll, you know.
But I mean, wouldn't you think that if the health department in Richmond County made that recommendation,
Mhm.
it would at least be filtering through the neighboring counties that there was something going on. So I would think that, and even the Board of Education in both counties, you would think something would be filtering through this area locally anyway.
Because she said that Cumberland
Who
County,
called you?
Dr. Patrick,
From the school system. Right.
and then Richmond County, she said Richmond County Health Department recommended. Then she said Cumberland County pool. And I don't know about Robinson County, so that's not confirmed. So I said I would just ask, 'cause I said I didn't hear anything.
Well, I can say that I do know from looking at
Oh,
the
she's
most.
got something here from the Charlotte server. This says Charlotte Mecklenburg School is indefinitely putting on hold its plan to distribute clear backpacks to high schoolers after finding many of the bags had a warning label about cancer-causing chemicals. So that's Charlotte.
But that's a newspaper.
That's the newspaper.
Yeah.
Yes, from
So
newspaper.
I would need
Yeah, it
some,
came in the shop.
the
Background.
the
But
background
the
and the
reasoning
data
was
for
that there
that.
was a label. It
But
wasn't
I need
still-
the label
Yeah.
still, we put labels on things that may not really be an immediate risk. I mean, if we were gonna put labels on stuff. I think this was-
Wouldn't know that.
You know? So I'm just saying, but like there are labels that, you know, they're cancer causing things and like lots of things that we touch and intake and that we use every day. So just because the label says it doesn't mean that it's something that we have to make, you need to make large system-wide changes on, especially at this time when school's just about to start. And if we don't have the scientific evidence, not a article in a newspaper solely, I need to see the scientific evidence that supports that. And then I would have no problem in excluding a backpack for kids, but if we don't have the science behind it, you can't make it a rule for everyone. So that's kind of the same thing as people also have to have those things. They put it in place for a certain reason. So unless we have some scientific evidence to completely overrule it, I would not be like, let's make it a system-wide change immediately today.
So could we ask Madam
The
Health
Health- the
Director to
Richmond
do
County.
research?
Yes,
If you find that there is an immediate need, pull us back together and deal
and we
with
can
it.
do
If not,
it. Yes.
kids will be real happy.
They tired of these
It's been
people.
a fight for the last 2 weeks at my house, so yeah.
Yes.
Basically, it kind of looks like that there might be a warning because of an issue that might be related to using the backpack in the wrong way. So the comment here is as long as you don't plan to cut your backpack and chew it and eat it, it might be okay if you touch it. So whatever we can find research wise. And some of those warnings are on things so that they're not used the way they're intended. If they're not used the way they're intended, there could be a danger if we don't use something the way it's intended. So we'll get a little research on that and see.
All right. Well, that's all I had to say. Anybody else got anything informal discussion?
I do. I just wanted to ask, I had talked to Miss Amanda about it. When you look on the activities report that's up on the board, we have to check every call that we get that comes to the health department. And we've been doing that for several years. I mean, unless that data is driven for the Board of Health, it takes a lot to keep up with that. And now we're really short-staffed at this time. But I mean, is there a reason why we would continue to have a number of every call that comes into the health department?
So you have to, are
Oh,
you saying you
yeah.
have to
Like
count
a-
it?
We take every.
Oh,
every
oh,
clerk
yeah,
has to
I know
check
how
the
that
calls
work.
they get. When I
That
say
was
So we don't
check,
really- we
it's
don't-
count.
Why was
We've
that,
been doing it for years, but it's on there as the calls that come into the health
why
department.
was that started? Do you know? Do you
It's
remember?
been, ever since I've been there, it was already in place. I've asked about it before and it was not, stopped at that time. I think that was during the time maybe Miss Patterson was here. We addressed it at that time, but since then not, but it's just a lot. And unless you're just driving data from that, I just want to request if we could actually just stop taking calls.
So are we using it for anything like
There be a reason for
grant
that?
funding or data accreditation or anything?
No, I've actually spoken to Tim and he said no.
No.
He's the finance person.
'Cause
Well,
we
you know,
don't-
if you
know
need from time to time to keep up with calls, I mean, you could do a random call count, so to speak.
Right.
If you needed that data
Yeah,
for
we
some
needed
reason,
it.
you could do it for a
Mhm.
week or two or whatever. But I don't know if it's not
But we don't ask
driving
for it 'cause we
anything, I don't
don't-
see any point in doing it.
That we could just remove that part from the activities and what that would be okay with the board.
Do you want to make a motion?
Yes,
How is this generated? I mean, I see lines, but what is this based upon? Phone calls, people in the building? What is this based on?
number of calls that come into the health department. And when you see it at the bottom, we averaging, right now, we're averaging possibly.
No, he's for in general.
Oh, okay.
That's all our clinicals, all of our services in health department.
Okay,
And so like for clinical services, we do numbers, all the supervisors send their numbers to me. For all family planning, all STDs, communicable diseases, and then it ends up on this graph.
I feel like if it's not needed for reporting data or accreditation, then you shouldn't have to keep up with it unless you need it for something.
I don't,
Okay.
Could be kind of important information.
because
When
I
people
honestly
calling
don't
in
know
for, you
how accurate it
concerns and
is.
things,
If you've
depending on
got
what statistics
Right.
the
you
phone
get.
ringing, people in front of you, it's kind of hard to
It's
say,
probably-
oh, that
It's
was,
probably skewed because you might
It-
not
yeah.
write down every one.
that was animal control, this is clinic, or, you know, I don't know.
I can see the check-in patients that we see in a month.
Yeah.
And that's accurate. We could go in and get.
So
the
this is
count
just
of
for the phone calls.
that.
So we need a motion to delete, keeping up data for the amount of phone calls coming in.
I have a question first.
Yes, sir.
If it's not that important, why does the board even have to bother with
Right.
voting on
Cause is it in policy anywhere? So it's not in
it?
policy.
Who's gonna
So
get
we
in
don't have a
trouble for
policy.
stopping it?
So-
I'm not quite sure when
so-
this process was implemented. It was, in place when I, assumed the position.
And I just
Well, no,
continued
something I
on.
don't even know
I
anything
didn't
about.
get into detail as to why this was put in place. Other than record keeping, benchmarking, I don't really see a need.
So do we need to vote on it?
I don't know if it was a
'Cause it's not a
previous motion to be on the safe
Safe
I
side.
said important. If it's not important, why should we have to vote on it?
But I think because
Just
we
to
are
say-
the governing board,
Right, just to say it's in writing that
we
say,
need to
hey,
be the ones to say
say
it ended,
it
so
ended
they
today.
don't get in trouble
Right.
later if they really should
Just-
have kept
Right.
it.
Well, we'll be in trouble later.
Yeah, we will be in trouble.
That's all right with me.
Okay,
Just a
we need
question.
a motion in a second.
I make a motion that they no longer count the incoming calls. And should they need a sample for some reason for statistical purposes in the future, you can just pick a time frame and do a random sample.
Oh, yeah, like a time moment.
Yeah, you could do a week or 2 days, whatever. If you ever need a random sample, you can just pick the amount of time you need a random sample for and just do it during that time period.
So we have a second.
I'll second.
Okay, we have a motion in a second. All in favor say aye.
Aye.
Like sign. Okay, we have, the motion is carried to delete that data for the phone call, so. Okay. All right, is it?
I'm sorry. Amanda and I were speaking on last week about the Board of Health policies. Currently, there are 8 policies, and what we currently do now is I review those policies for any changes, if any. But I wanted to present this to the board and bring this to the board's attention, to get any ideas of how you all would like us to review policies going forward for the Board of Health.
So that was a question I had in my mind, because Ms. Diva referenced some policy changes earlier. And I wondered who does those changes? Do you all as staff,
Her and I
or
together,
does the board not have to have some input?
we'll bring any changes or updates related to board policies or agency policies that have board input. We'll bring that to the board. We'll put it on the agenda. We'll go over those changes or updates, and that's how we currently carry out those policy changes with updates to the board. But we'll bring the updates to the board and let you see what was changed.
The ones I referenced, there was no changes in it, but by accreditation, we have to look at them on a yearly basis and change the date at the bottom. But nothing in the policy changed.
I want you to get ideas from you all. I know the county commissioners have a policy review committee. I didn't know if that was something that you all wanted to put in
okay.
place. That also gets you a little more acclimated with the Board of Health policy, rather than just Amanda and I bringing that information to you. You'll actually be involved. So it's something to think about.
The Board of Health policies are way behind. It flagged this,
There were only 2 updated for this year. And
So-
performance evaluation policy was.
That was the, yeah.
So my
So-
personal statement would
Remember
be,
that one.
but I don't want to add more work onto a volunteer board. But one of my concerns, I don't want to, sometimes I feel like we're just a rubber stamping board. And y'all come here and tell us whatever, and we just say
Go
yay or nay and don't really know. It's just because we trust y'all.
Right.
But we didn't trust you. And so I do think that there should be more involvement from the board, especially in policy making, since that's one of our main tasks. But I don't want to speak for the entire board. But personally, I do. I feel like we should have a representation of this board who meets with staff to review policies rather than a simple, hey, we changed these few words in the policy. Because at the end of the day, the burden of that does not lay upon staff. It lays upon this board.
Because the evaluation is, that one we kind of made changes
Yes.
to, yeah. So if it was a committee, I
Wouldn't
wouldn't,
have been as
be on it.
difficult.
So if it was a committee, would we review the policies and we
Yes.
bring it to the board like that?
Yes.
Okay.
So would you, because we want someone on the board to be part of the review of the policies every year when you got to add that, change that date so that there's 1 or 2 board representatives that will work with,
Because it's
I guess the
always like the
director
chair,
and
it's
you.
always like the chair right now
Yes.
signing. So it would need to be,
So we need at least 1 or 2 board members that will meet with them when they're going over the policies
Cause that would help.
every year. I do think that
Yeah.
is a necessary thing because we need to know, and that person can kind of relay what we need to know as board members, because it makes it a little easier, because you guys are so familiar with it. When you explain those things to us, sometimes y'all will talk in terms, maybe not everybody kind of knows what, you know, all the terms and language mean. So I don't know if we need to.
So we can create a committee. Like, can we communicate like by email and ask who wanna be on it instead of doing it tonight? So everybody can think about it.
Mhm.
So that will go under unfinished business, right? Okay.
So we can have a list of who may want to do it or who'll do it at the next meeting.
Yeah.
She looks like, see, I didn't know.
And you said it's like,
I knew her.
how many flags?
It's only eight.
How many?
Eight policies.
That's flags that needs updated.
They're not, well, if you wanna say flag, but they need, 6 policies now need to be updated.
But I think they were also speaking on all the policies, right? Not just the board's policies, but
So this-
any,
Or this board?
If you all would like to be involved in the administrative policies, for the agency as well, since you are the policy-making, body, that's totally up to you all. I think it's a great idea, but
I would say, as responsibility wise, like
Yeah.
if something was wrong in an administrative policy, who are they gonna blame? They're not gonna blame you or, well, they might blame Amanda, but then Amanda gonna say, well, my board said it.
So we signed it. At the end of the day, we still
Yes,
signed it.
you know,
like,
so
I signed
somebody
it.
needs to be involved with administrative and board policies.
We need
I
to
mean,
get the
that's-
lawyer involved with this too.
that is a great, idea as well. We do have, Mr. Ed Johnston, I'm pretty sure Amanda has him on speed dial, just in case we need him. And we also have the School of Government, as a resource as well.
So yes, I think we need to kind of come together with a final like way we want it constructed to make sure that there is a board member working with you guys on policy. And we can
It's a
vote
good
and
idea.
appoint and have all that done at the next meeting.
Yes.
Uh-huh.
Administrative policy.
You know, Board of Health has a long way. You know, Board of Health has a long way.
So we might need to have 2.
I'm with that.
We need more than one person.
Involved in administration policies.
Huh?
The board typically has never been involved in administrative policies.
Or could we start out with
And we
just
might
the
have
board?
to, we,
No.
And start out, no?
We need to do them all.
Start
we
out
gotta
all-
do them all. Like if you either have to do it right or don't do it at all.
Currently, there are only 2
So-
administrative policies that,
Are
that have
flagged.
board input. That's the policy on policy, and the performance evaluation policy.
And that committee would like, well, we can discuss all that later.
Yeah,
Yeah,
we
that-
can figure out
that's
the
going to-
details, but we know that it needs to be presented in here.
If you read over the role and responsibilities of this board, we are responsible for all of the policies of the health department. And I'm sure Ms. Diva would appreciate the support and input of her board up front,
Right.
rather than having to have it if something happens with those policies.
I agree.
So Madam Chair, I would suggest on our next agenda, a meeting, we have a detailed conversation about creating a policy committee.
Mhm. And that committee can meet like once a month, or is there a certain time?
We determine that as a
We
board.
can
We'll
determine
determine
that.
that the once a month or whatever. Okay, though. All right.
You just gotta take small bites at a time. Yeah, you just have to take small bites at a time.
Yeah.
So you're not gonna meet in one session and do all 62 or all
no way.
60, you just do it small bites at a time. You take
Right.
3 or 4 of them on and go through them.
Mm-hmm.
The ones that need the most, if she said it's 2 that need to be reviewed, then you do those 2 plus another one. Next time you may do 3 more until you get through. It didn't get this way in 1 year, so you're not going,
Right.
in 1 month. So we're not gonna be able to review and correct everything in a month. So this is a working board, so it means you continue to keep working and doing it. So that's what we'll do. And once it's done, we won't have to redo this work again.
Right. All right. Is there any more informal discussion?
I move we adjourn.
Question. I have a question. What department, and it may not even fall under the health department, but what department deals with abandoned homes in the county that are an
That's
eyesore, but
condemned.
also a health risk?
Oh,
I'm
yeah.
glad you asked that because I just had a meeting today with, what was his name? Officer Ford with the Sheriff's Department. It does fall under public health. And he has asked me to make a couple of visits with him because he's still handling the solid waste stuff now. And he showed me some pictures today that it was just mind blowing at some of the trash and the buildings. So it does fall as a public health. So I told him I'm leaving in the morning to go to Raleigh for the training, but I'll be back on Friday. So we're gonna get together and make some visits and write out. I told him I could in the letter.
We have 2
Because
to
it
3
doesn't-
houses in our community that have been abandoned for a long time and have posts up where they, I guess, I think I understand a couple banks own a couple of them, but they're literally boarded up. Neighbors are taking care of mowing grass and cutting weeds off because it's just so terrible. And I think some kids could get in over there. One has a abandoned pool in the back, it's just full of junk. And came and put a temporary fence up around it, probably because someone could go in. But I think it's a hazard where there's some young kids could fall in that pool, or
That's what,
there could be
Yeah.
varmints in it, or raccoons or whatever. I don't know, but it's in a nice neighborhood, and I pass it every day, and the neighbors around there are taking turns mowing the grass and cutting things because it's such an eyesore and embarrassing for the neighborhood. But I would think that whoever owns it is responsible for taking care of not only the yard, but how it looks. And this one has gotten to the point where it just needs to be torn down.
some of the pictures he showed me, there was one that was a commercial property. And he said it hasn't been in business in quite some time, but the roof is gone. Somebody had placed old tires on the inside. Part of the roof was being held up by something to me that looked like a 2x4. I mean, just, and a kid got in there and knocked those boards loose. It's definitely a hazard.
So I was wondering what entity calls the bank or whoever owns the property to get them to do something about it. I mean, this particular house is uninhabitable at this point. It's probably full of mold and everything else. I know the whole backyard pool area is. I don't, what can we do to move on
Officer
this?
Ford said that he had already went to the zoning director, inspections, and everybody kept putting him off. I pulled statute and looked at it, and I do have the authority as the health director to write him a letter for the people that actually own the property. to clean
You've been through those kind of
So,
conditions.
and he's also working on trying to pull a task force together. So it's in the works. We're working on it.
Well, I'll give you the address of this one.
Yeah.
We're gonna, go ahead and adjourn, and then y'all can continue the discussion after. And I know Ms. Rivera gotta go on. So we had a motion to adjourn. Do we have a second?
You get in section 8.
Okay, all in favor say aye.
Not required, so.